We now want to tell you about the progress that we've made with these big challenges. Our vision talks about caring for people in a seamless way that isn't restricted by either organisational or professional boundaries, so streamlining care. We talked about improving the quality of services and ensuring that the people of Gateshead live longer, happier and healthier lives, so a focus on quality. And we talked about ensuring commissioning is clinically led and driven by patient and carer involvement, so involvement. So the delivery and our key achievements so far. Let's start with the work with practices. We've done a lot of work on streamlining care, particularly between practices and providers, improving both the information that flows between them and trying to get the whole process and pathway for patients much quicker and better. We've focused high on quality and trying to set up a system to report incidents that happen across the system through practices, so that we've got a better chance of knowing what the problems are and trying to solve them. We've done a lot of work with involving people, firstly by implementing the Practice Clinical Commissioning project so that all practices and all staff there understand what commissioning is and try to help us improve the system, but also trying to involve patients and making sure that practices are setting up patient groups. We've done a lot of work in other areas, particularly commissioning across the spectrum of ages. For example, we've done some work with changing hospital services for children, working between hospitals there, and improving services for care home patients. We've done a lot of work on commissioning across different diseases. For example, we've done work with primary care and practices about how we improve care planning, so understanding what people want to happen in the future and trying to ensure it happens. We've got many good examples such as chronic obstructive pulmonary disease, a disease that is very debilitating, and trying to bring together all the providers there and trying to help the services improve and be more joined up. There are many other examples I could give, such as diabetes, skin conditions, irregular heart rates, bladder problems and prostate cancer, just to name but a few. All of those have been examples of services that we've rechanged to try and improve things for people. Many other examples that we could give. We've worked with different providers to try and get them to join up their work, such as our award-winning musculoskeletal service. We've done a lot of work in different settings, not just the hospital settings, not just primary care, but the community, so that we can move work from hospitals into the community where people would prefer to have their care. And this example is where we've set up a service for giving people drips, intravenous antibiotics, when they have infections in their skin, cellulitis. The biggest piece of work we've done is our urgent care hub, where we've tried to integrate the work of walk-in centres, A&E, out-of-hours GPs and many other organisations to try and streamline this. Our vision is that we can continue our 3 points about streamlining care, improving quality and involving people. So if you are a user of our services or involved in providing health services in Gateshead, please do contact us. We'd love to hear your views.